At PICA, we believe that protecting your practice goes beyond malpractice coverage. One of the most important and most overlooked steps a podiatrist can take is understanding the value of their practice. Whether you're navigating a divorce, a partnership dispute, or a practice acquisition, the more lead time you give yourself, the better the outcome. One area where valuation becomes critical and where we've seen doctors caught off guard is divorce. Settling matters like equitable distribution and spousal support is already personally and financially demanding. Not having a valuation ready only makes it harder. The number of doctors who call looking for a valuation at the last minute is significant. Many have told us mediation failed and they now need evaluation for trial. Having a credible valuation before mediation gives you the opportunity to resolve the matter without ever seeing a courtroom. We've also seen cases where one side chose not to obtain a valuation and simply tried to poke holes in the other side's numbers. Unless you can demonstrate the opposing valuation lacks merit, the court is left with only one value to consider. That's not a position you want to be in. A review appraisal of the opposing side's valuation can also be a powerful tool, identifying where their appraisal falls short of professional standards and giving your attorney a clear blueprint for deposition and cross-examination. Partnership disputes are more common than most doctors expect. Whether a partner is retiring, relocating, exiting voluntarily, or being removed, litigation typically centers on the value of their ownership percentage. Trying to negotiate a settlement without a valuation almost always makes the situation worse. Knowing the value of your practice allows you to negotiate with the other side, not against yourself. Even when a process is outlined in your operating agreement, those terms are often outdated and no longer reflect the current value of the practice. An independent, timely valuation keeps everyone working from accurate, defensible numbers. For associates looking to acquire a practice, the process starts well before any valuation. First, meet the owner. Discuss the clinical side. Determine whether you're compatible. If it feels like a good fit, request a tour after hours, get a feel for the space, and gather basic financial information like collections and a profit and loss statement. If both parties want to move forward, that's when valuation comes in. The valuation will give you an assessment of the risk involved in buying that practice and an appropriate offering price that reflects that risk. It will also give you key metrics to compare practices you may be considering. Typically, multipliers fall between 2.5 and 4.5 times earnings. The investment horizon is generally 2 to 4 years. And practices tend to value between 25 and 65% of the prior year's gross revenue. Armed with this information, you'll have the ammunition you need to negotiate a deal that works for you. Understanding how a practice is valued can also help you identify opportunities to improve your practice's worth before an evaluation ever takes place. Think of the process the same way you think about diagnosing a patient: case history, physical examination, diagnostic testing, and a report of findings. The case history begins with an information questionnaire. This covers your catchment area, clinical focus, case mix, payer mix, office hours, staffing, active patients, production numbers, surgical encounters, and any pending liability claims or compliance issues. The document request typically includes 3 to 5 years of tax returns, general ledgers, production reports, W-2s, employment contracts, operating agreements, and office leases. The more complete and accurate the information you provide, the more accurate the valuation conclusion. From there, the physical examination begins. Tax returns are spread to identify trend lines. Are collections growing, declining, or erratic? Expenses are normalized to remove personal or non-recurring items. The result is an adjusted net cash flow, or EBITDA, which stands for earnings before interest, taxes, depreciation, and amortization. Diagnostic benchmarking follows, comparing your practice against MGMA data and internal benchmarks covering production, collection ratios, overhead expenses, accounts receivable, and per-provider performance. This tells us where your practice stands among your peers. Finally, a report of findings is issued, both oral and written. Time and again, our clients tell us the valuation process gave them a much clearer picture of their own practice than they had before. Whether you're planning for the future, navigating a dispute, or preparing for a transition, having the right advisors in your corner makes all the difference. PICA is proud to connect our policyholders with expert resources, including practice valuation specialists who understand the podiatric space. To learn more information on the process of evaluation, visit our website at picagroup.com.